Good morning. We are recording um, the October 17th weekly webinar on the 16th. So, morning of the 16th, we will start talking about the ongoing federal government shutdown because that has been what has been the focus of the news this week, as well as certain actions the administration has taken in response to that shutdown and some of the impacts that are starting to trickle down to states and programs important to people with disabilities. So, just a reminder of where we are. Every year, Congress has to pass 12 appropriation bills to set annual funding for many, many different programs and agencies that deliver services. So there's 12 separate bills, and they have to be passed by September 30th, which is the end of the federal fiscal year. And if Congress has not passed those bills, or a shorter term continuation of funding called a continuing resolution by that date, then the money to run all of the things that would be funded in those appropriation bills runs out. And those functions have to stop because there is no more money to continue paying for that work. And we have focused on a few of the appropriation bills because there are certainly some bills that have a lot more agencies that do programs related to people with disabilities. The Labor, Health and Human Services, and Education bill is one of those appropriation bills, but there are 11 others. Congress was not able to pass those bills by the deadline, and they were not able to pass a continuing resolution to continue funding those agencies while they worked on those appropriation bills. And so the federal government has been shut down since October 1st. Generally, during a shutdown, not every federal program or federal pot of money is affected the same way. But those things that need annual funding bills passed, if you are an agency that it has funding from those 12 appropriation bills, generally what happens is workers are kind of divided into two groups. One is called non-essential, which essentially means they are furloughed or told do not come to work, but we are also not paying you. Or they are designated as essential, which means they have to report to work and they are still not paid. It doesn't necessarily mean that the people who are designated as non-essential don't do important work. But things like air traffic controllers and other kind of jobs that require somebody to be present for safety and other things tend to be in that camp of report to work, even though we're not paying you because you're essential. So since October 1st, we've kind of been in a cycle where the U.S. Senate has been taking votes to pass a continuing resolution, and they need 60 votes in the Senate to pass it, and there is not enough support to pass what the House has already passed. There's also not enough support to pass the proposal that the Democrats in the Senate have advanced, which wants not only the government to stay open, but also some additional guardrails to make sure that the spending that Congress has authorized gets to where it needs to go and is spent as Congress intends, as well as rollback of some of the Medicaid cuts that were made in the reconciliation bill that passed on July 4th, and also an extension of the Affordable Care Act subsidies, which are due to expire at the end of the year. So that has been the conflict of, between the two parties, is there's a disagreement about if we pass the bills as normal, we are worried about, whether or not the agreements that we have will be honored and hold true. Um, on October 10th, which was last Friday, the administration, instead of temporarily laying off workers, furloughing them, um, appears to have made a move to permanently fire more than 4,200 federal employees. And this was a discussion that had been threatened since before the government shut down, that if you shut down, we will use that as an opportunity to permanently fire workers. And so there have been a number of workers that have been notified that they are in the pile of people that is being permanently fired. Um, October 10th was also the first federal pay period that was missed. The U.S. Speaker of the House, Speaker Johnson, has continued to not bring the House back to Washington for a regular business session. And that has really meant that the only pathway to opening the government is for the Senate to pass what the continuing resolution that House has already passed. So this week again, the House has not been in session, which essentially means the government shutdown will continue until at least next Monday. And then we will have a replay of the same decision making, whether or not the House will come back in, or if we really are in a position where it is the Senate that continues to have to figure out a path forward. Many watchers thought that this week there could be a pressure point this week. October 15th is the pay date for active military personnel. There was a desire to pass a standalone bill, at least in the House, to say, hey, let's approve pay for the active duty military. There was no standalone bill. The House did not come into session, and the executive branch, the president, and the administration decided to do something different. They, again, took money that was budgeted for something else in the Department of Defense and decided to use it to pay active duty troops. Many watchers do believe that this is illegal for a couple of reasons. One, the money that they use to pay the troops was very clearly budgeted for something completely different. And the second reason is, even when you moved that money from one account, and it was an account where the money was allowed to be spent for 2 years, so through 2026, even when you took the money from that account, and if you moved it to the line item that pays the troops, because the government had shut down and there was no authority to spend any of those appropriation lines, moving the money was not sufficient to be able to pay, to use that strategy to pay troops. So this is, again, something that will likely be part of a legal battle, but in effect, what it means is that our active duty troops have received a paycheck. And that leverage point that folks were pointing to as being a reason why the shutdown might end did not happen. Idaho began their open enrollment period for the Affordable Care Act subsidies on the 15th, which means that people in Idaho are now receiving letters that tell them how much their premiums are going to go up, and those letters are based in the premiums expiring at the end of the year. So if you've been attending these webinars, you know that for every state, there are lots of marketplace plans that have made decisions about whether to offer a plan or all, or they've had to make decisions about how much do we charge for premiums or out of pocket costs, or what do plans cover, to account for the premiums that are the subsidies that are expiring at the end of the year. So Idaho is kind of the first state where people are getting this notice, and they are now going to have to say, can I afford that or not? Many watchers believe that the increases in premiums will be too much for many people who are in the marketplace, and they will either not be able to afford a plan at all, or they will have to pick a very different plan. Many other states this week will be sending out similar letters to members of their marketplace plans, and then every other state begins their open enrollment period November 4th. So there's a couple of kind of key leverage points that are coming up. And for members of the Democratic Party that are really trying to emphasize the consequences of letting the ACA subsidies expire, this is a very important time period where there is a lot of communication that is happening directly with people who have those plans on, what their costs will be if those subsidies are allowed to expire. And as we've talked about before, if Congress doesn't act very, very quickly, really before the end of October, we do expect that there will be many people who end up having to make decisions in the open enrollment period, potentially before they know whether or not those subsidies exist, and they will perhaps make very different choices, based on the information they have. So 2 weeks from now, October 31st, there are government workers who get paid monthly. That would be the first paycheck that those workers would miss. And there's also a number of programs that send funding to states on a monthly basis. So the consequences of a shutdown kind of keep increasing. And there are certainly programs that have had a certain amount of money in hand and will start running out of that funding as soon as the end of this week. Now remember, all of the votes that have happened so far have been about whether or not to approve the continuing resolution that the House already passed. The deadline the House set as the next deadline to basically either have all of your negotiation and your 12 appropriation bills passed or not, or have to do another continuing resolution, was November 21st, which really is not that far away. Many watchers are starting to see that they don't see that this will be completely resolved, perhaps by the deadline that's in the current CR. And some people are starting to see November 27th, which is when Congress would go on Thanksgiving break, as the next real leverage point for the shutdown. All of this is a very long way to say that we are now the third week into a federal government shutdown. We are experiencing some changes that choices the administration is making, and the fundamental issues that Congress is trying to work out really aren't changing that much. The dynamics of, what is being asked for is not shifting. So we've done a little update here. The Republicans have up to this point, and remember, the Republicans they have the majority in the U.S. House, the majority in the U.S. Senate, and they are also, the Republican Party is in charge of the executive branch as well. They have been very strong on maintaining a position of, we're not going to talk about any of the things that the Democrats are raising as conditions for their votes. We're not going to talk about any of those things until we've reopened the government with the current CR that was passed many weeks ago. The House Speaker has continued to apply pressure by not bringing in the House. And that means that if the continues to not pass the continuing resolution the House has already passed, there can be no opening of the government. There is no other, the House is not there to negotiate or to take bills that the Senate may have changed a little bit and look at them and say those changes are okay with us too. Because remember, the US Senate and the US House have to pass the same language in order for the bill to be able to be signed into law by the president. Meanwhile, the Speaker of the US House has made some public comments about Congress canceling previously approved funding. You may remember that that kind of unusual step happened this summer, where the administration asked Congress to take back several billions of dollars of programming that they had approved in March. And Congress did go forth and approve that. There also were many programs where Congress had allocated money and had expected those funds to go out and be distributed as they normally would have been. And there were many pieces of funding where that did not happen. So that was called a pocket rescission. Essentially, funds were held until September 30th when the authority to use them expired. So the process of, Congress approved a continuing resolution in March that said, here's how to spend money on all these programs. And then some of that funding, quite a bit of that funding, did not actually get spent as it had been negotiated in that CR. And this is another sign that at least Speaker Johnson is saying there's some willingness to use a taking back of approved money as a leverage point at this point. There's also some interest this week. Again, there are 12 appropriation bills, and there is some agreement on some of them. The Congress has been working on those appropriation bills and negotiating between the Democrats and the Republicans on what to spend money on. And there are 3 out of the 12 bills where there is a lot of agreement between the two parties. So one strategy that may be used as soon as tomorrow is for the US Senate to try and key up a vote on one of the appropriation bills, or perhaps more than one, where there is agreement, and try to get Democrats to agree to at least partially pass funding for the next year on some parts of the federal budget. The Republicans are talking about what to do about the ACA subsidies, although they are not doing that very publicly. So, that's kind of where we are on that side. Meanwhile, the White House has made a number of comments publicly about what they would do if the government would shut down, and they are starting to follow through on some of those statements. So last week on October 10th, they did follow through on an earlier threat to permanently fire federal workers instead of just temporarily laying them off, as has been done in the past. There's also been a number of money, a lot of money, I think almost $30 billion that was sent to states for various projects, mostly infrastructure projects, that the administration has decided to stop or take back. Again, we talked about the taking of money appropriated for one thing and moving it to pay for a purpose for which it was not authorized, to pay active duty troops. That has happened as well. There's also been a comment that all of those workers who are currently not receiving pay because there's no money to pay them may not get back pay for that time. In previous shutdowns, it has always been the case where workers who were put on furlough or workers who had to report to work anyway without pay would get the amount of money that they would have been paid had the government stayed open for that time period. So this is a very different approach to that. There's also been some comments to take money specifically from Democratic programs, and it is unclear exactly which programs those are. Federal programs are not tied to a specific political party. There are lots of federal programs that do different things, and members of both parties may support those missions, or members of one party may like them more or less. So it's unclear which particular programs are being targeted here, but there's certainly a sense that there's a desire to make cuts and deeper cuts in programs that the administration feels the Democrats support more. For the Democrats' part, they are also in a position that hasn't changed very much. They insist they will not provide the votes needed to reopen the government unless they have some real guardrails, some real agreements about not only extending the subsidies, but also making sure that any budget that they do pass is honored by the administration. They are also seeing that, the greater awareness of people who are in marketplace plans of the consequence of not extending the subsidy helps demonstrate what the Democrats' position. So that kind of tells you that some of these dates we've been talking about aren't necessarily pressure points to open the government. Sometimes they might be pressure points to make sure that people understand what is the consequences of not doing certain policy items. And there is a kind of undercurrent that Democrats are very concerned that passing the regular budget bills may not actually mean that much if Congress, if there aren't any guarantees or language that really make sure that the administration spends the money as Congress has instructed. And that piece of it, which has not been the primary message that many folks have been hearing about, at least in the media, is really the fundamental core issue at stake here. If you want to read an in-depth article about kind of the history of how shutdowns have worked in the past, and the idea of when has the executive branch decided to stop payments or do other actions that have really changed the intent of the money that Congress has appropriated for certain things, this is a good article. And it goes through, like, why is there something called the Impoundment Act and how it's been used, for example. But I think the main takeaway is that there has been a pattern over the past 9 months where the administration has really acted independently of Congress. And you may remember in the spring, especially in March, that there was another large mass firing of federal workers, as well as a stopping or freezing of funding that Congress agreed to spend on a variety of programs, including one day where the Medicaid portal wasn't working for one day. And there's also a pattern of the administration coming back to Congress and saying, we don't want to spend this specific money, and we'd like you to tell us that's okay not to spend it. That's called those rescission bills. So I do think that part of why we are in the shutdown now is because there has been a pattern over the last 9 months that really makes it seem like that Democrats could agree on certain budget items with Republicans, and that agreement won't be honored by the administration. Meanwhile, there are some Republicans who are very concerned about the expiration of ACA subsidies and do see it as a concern for a lot of their constituents. There are also Republicans who do not believe that they want to extend the subsidies at all, and feel like the entire system is contributing to fraud, waste, and abuse. Or is some those subsidies are actually payments to insurers as opposed to helping keep premiums low for consumers. But there's still talk about, okay, what would we do to extend the subsidies? And although there has been a bipartisan bill introduced in the House to just continue the subsidies as they are for one more year, most people are saying that is unlikely to be what happens. That if the subsidies are extended, they might be changed in terms of how much, um, who gets those subsidies, and how much they're worth to people, as well as perhaps having some additional payments required for marketplace plan holders. And as we have discussed before, the timing by which Congress acts makes a big difference. The more uncertainty there is about whether subsidies will be extended at all, or whether the same subsidy that you have now is going to be the same in the next year, will make a big difference to people as they're trying to figure out, are they, keeping the same plan or changing plans or going uninsured for the next year. We are now starting to see more federal functions being directly impacted by the ongoing shutdown. There are certain federal agencies that do a lot of direct customer service for people. And Social Security is one that a lot of aging and disability folks interact with quite a bit. Some of these places have the ability for you to go online and take care of certain kinds of business independently yourself. But there's also lots of people who either don't have access to those to the technology needed to do that kind of service for themselves, and or they have more complicated questions, or it just isn't clear what they have to do to solve their problem. So every federal lawmaker is usually pretty open about wanting to help constituents, especially if they have challenges with a federal agency. And this is an opportunity, if there are things that you normally would be interacting with a federal agency on, and the lights aren't on, there isn't a person that's able to help you, you aren't able to get what you need, and that is causing other impacts in your life, you can ask your federal lawmakers to open a constituent case for you. There's also a lot of federal funding that supports programs that are operated by states, and we have a few examples here. Community health centers, a lot of the aging and disability programs, like Meals on Wheels, but not exclusively those, Food Share, WIC. And again, if you're experiencing changes in service or service delivery because the states aren't getting the money or aren't getting the federal support that they normally do in order to be able to get that money out to where it needs to go, this is another opportunity where you can, again, open a constituent case with your federal lawmaker and let them know what's impacting you. And every lawmaker has, you have two U.S. senators, so you are represented by U.S. Senator Tammy Baldwin and U.S. Senator Ron Johnson, as well as one of the U.S. House representatives. So you have to kind of know where you live, which district is your House person. So there's three people at the federal level where you can contact them and open a constituent case on an issue. And we've provided, the online place where you can go and kind of type in a complaint or your phone number. So we have the two U.S. senators here, and then all of our 8 House districts. Some of the national disability groups have put out a pretty decent plain language explainer of some of the major areas that impact people with disabilities in a government shutdown. So you can read this at your leisure, but these are the 5 areas that are covered by this document: Medicare, Medicaid, Social Security and Disability Benefits, SNAP, WIC, housing assistance, and energy assistance. And there are some specific impacts that we are tracking and the media is tracking with certain agencies that impact a lot of different people. So, for example, Social Security, there is not an interruption in the normal benefit checks that are sent out to older adults and people with disabilities. But because of the shutdown, and also because there have been a reduction in the number of federal workers, in-person support is suspended in some cases or very limited. And especially important is in-person support for benefit verification letters. If you can still access your letter online through the Social Security Administration's automated or through the phone system, but there are lots of people that need additional help, or who may be trying to get a letter for the first time. So they may not have a letter yet. That's something that they need. And they're pretty important because they also often act for income verification that are needed for other, means tested benefit programs. So this was an example of, if you're unable to get the benefit letter that you need, it may have other impacts on your ability to, go through other public benefit programs, and it may have a lot of impact very directly on people's lives. And that's a good example of, if this is something that's impacting you, you can open up a constituent case. Another thing, we have heard from several people who have, many people with disabilities and older adults are in both Medicare and Medicaid. And a lot of folks have taken advantage of telehealth for Medicare services, and have been reporting to us that their telehealth appointments are being canceled, or they can't make an appointment for telehealth. Well, there is actually a reason. Medicare has some ability to pay for telehealth that was expanded, but the continuation of the ability to pay for telehealth appointments has actually not been put in statute. It has been always part of a continuing resolution. So those kind of short-term budget bills that Congress has continued to pass every year have included language that has reauthorized the ability for Medicare to pay for telehealth. Well, we don't have a continuing resolution in place. So that means that the funding for telehealth services has stopped because there is no continuing resolution, and there is no authorization on how to pay for that anywhere outside of that resolution. And this article points out that even if there is a continuing resolution passed, it really only restarts the ability to pay for those things until the next deadline. So there are some real consequences for using continuing resolutions as your pathway to keep reauthorizing funding. And this is a good example of why it's sometimes you're not wise to do that if it's truly a service that you want to make sure continues and is uninterrupted. This article has an audience of states, but it's important to remember that about a third of most state budgets is made up of federal funding. And it is, like we've talked about, Medicaid, because Medicaid is really the largest budget item for most states, and it's the largest piece of federal funding that states receive. But there are lots and lots of other federal funds that states get from hundreds of grants and other programs that may be starting to be impacted by a government shutdown. And this article does a pretty good job of saying, it's not a third of state budgets isn't all in jeopardy at once. There's certainly funding that expires at different times. not everything is directly impacted by the shutdown immediately. But it's also very clear that the longer the shutdown happens, the more likely it is that states that are expecting to receive federal money won't get it. And the harder it is for states to continue services uninterrupted that rely on federal dollars to run them. In the past, when the federal government has shut down, states sometimes have chosen to continue to run programs even though they're not getting federal money. Like they may look under their couch cushions and move some stuff around and say, okay, we have enough, kind of rainy day money to continue operating this program for a certain amount of time, assuming that federal funding will come back at some point and that maybe we will be paid for the time, we will get the back pay essentially for the time that it was only state funding that was operating the program. But this time, states are feeling a little bit differently. This time, states are very worried that they might not get the state funding that they put in to continue operating programs back from the federal government when the shutdown ends. And that's, there's a reason for states to be worried about that when you have an administration that, again, over the last 9 months has had a pattern of freezing funding or impounding funding or delaying funding coming to states, or stopping funding or taking funding back, and has also said, well, maybe we won't give back pay to the government workers who are currently furloughed because of the shutdown. You can see why a state would be worried in that context about, hey, if we put in some money to make sure, say, the woman, infant, and children funding keeps going out to families, how much can we afford to do that if we never get, and if there's a possibility that the federal government doesn't pay the amount that the state put in that time period when when the government was shut down. It's also important to notice that the shutdowns affect more than just dollars. There's a lot of federal government functions that states rely on, grant making, you know, applying for money that might be available, so, technical assistance that helps states know how they can and can't spend dollars or what they need to do. Remember, there's a lot of changes in laws or administrative rules that might mean states have to change what they're doing and think about, whether or not they need to invest more money to be able to be in compliance. Or just different changes in how programs are administered. So when those functions stop, it causes slowdowns, delays, and problems for states. And it also means that when the government opens back up, it's not like turning on a light switch. Not everything comes just on and it's running as it was. It takes some time for those gears to start turning and for all of the backlog of issues and problems and concerns to kind of be unwound by federal workers returning to work. Another important community resource that is directly impacted by the shutdown now is community health centers. And I think we have about 16 of them in Wisconsin. These are clinics that are funded directly by one of those 12 appropriations bills that haven't passed. And the funding for them was in the continuing resolution, which again has expired. It provides about 70% of the federal funding coming into those centers. And these again are local programs that tend to have very small cash reserves. These clinics are often in places that are rural or hard to get to, and they often serve people who are either uninsured or high proportions of Medicaid payments, which often do not, are not as high as clinics and hospitals would like to cover the actual costs of care. So for a certain set of health centers and clinics who are funded in these ways, this shutdown is really putting a pretty big vice on their operating revenue. Another impact related to Social Security, generally, October 15th, middle of the month, is when the Social Security Administration adjusts the cost of living. In other words, they look at a certain subset of different costs. Healthcare isn't one of those costs, but a certain subset of those costs and say, okay, how much more do we need to add to people's benefit checks to kind of make up for the increases in what we're counting as the cost of living? And they do this every year, and it's really based on inflation. You know, how much more does it cost from a year ago to do the same things? So it was supposed to be adjusted this week. It isn't because hasn't been because the people who would make those calculations are not they're not working right now. They have shifted when that adjustment is coming out to next week. We may see it continue to shift if the government shutdown continues. And usually, these adjustments rely on another set of data that's usually released in September, which also has not come out yet. So you can kind of see there are routine government functions that kind of hum under the surface that are being delayed for various reasons, and maybe won't be worked out, immediately when the government reopens. Wisconsin has had a couple of articles out this week, specifically about the Women, Infant, and Children's Program and Food Share, which are both nutrition programs. They provide money to certain sets of to households to help them afford to buy food. And WIC may have may run out of money first, but they are trying to convey that there's enough money to keep running these programs as they are through October. But if we are getting to November, that would be an example of programs that are used to getting a federal allotment, money from the feds to keep running for the next month. So if we get to November 1st, or we get to later in October, the money that the state has received for those programs will start to run out. And we will again be in a position where the state has to make a decision about how to, either operate a program without federal dollars or figure out another pathway until federal dollars come back in. So one of the things that folks can do, there's just a ton of programs, and people with disabilities and aging older adults are affected by many of them. And this organization is federally funded. The independent living centers, ADRCs receive federal funding, Meals on Wheels, a lot of the services that people know and engage with daily, transportation pieces, receive some amount of their operating dollars from federal funding. And the longer we go without a permanent budget and without a guarantee that the money budgeted will actually come to the places that it's supposed to go, the harder it is for, first of all, those programs to keep running, because eventually they have a set amount of money, and if they don't get more in, they will run out of money. But it's also really hard for programs and counties, because a lot of these dollars flow to counties and nonprofits, to develop their budget for next year. And counties and local municipalities operate on a calendar year budget. So they are in the thick of it right now, trying to get their budgets done by the end of December. So having a government shutdown right now with a lot of uncertainty about funding is directly impacting how they're thinking about next year and the uncertainty that they can't plan for. So one thing folks can do in addition to opening up constituent cases for specific issues that you are running into as you engage with federal or state or local programs that are impacted by federal funding shutdowns, is to connect again with your members of Congress, your 2 U.S. senators and your 1 U.S. House rep, and talk about how important it is that the normal work of budgeting not only is completed, but that Congress really does have to make sure that the funding that it says it wants to spend on all certain things is spent as expected and in a timely manner to make sure that the people who need help and support continue to get it, and all of the the ways that those programs run, whether it's coming into the state or the county or a local organization, continue to have the operating budget to do the work that they do. Congress has a lot to do besides figure out the federal budget, and figure out a path forward out of a shutdown. We are now close, we're in mid-October, on the other side of the midpoint of October. And really, they only have about 8 weeks left to figure out their 2026 budget for next year, figure out whether or what they're going to do about ACA marketplace subsidies expiring. There was some amount of interest in doing other legislation, and certainly there have been some discussions of the cuts that were made in the reconciliation bill July 4th, HR 1, were deep enough that they would require kind of across the board cuts, which is called sequestration. So there's also some other considerations that haven't really been discussed or started yet that are continuing from the passage of that earlier bill. We're now going to go into what are some of the actions that the administration has been taking during the shutdown. You may remember before the shutdown happened, the administration was saying, hey, if you let the government shut down, we're not going to just lay off people temporarily. We're going to make permanent firings of federal workers. And they didn't do that for the first 2 weeks, but last Friday they acted. So they sent out what is called a reduction in force letter to more than 4,200 workers. And it does appear that they were targeting some places more than others, and following through with their comment about we're going to remove funding from programs that don't match this administration's priorities. You may remember in March that there were a lot of federal workers who were fired, and some of those firings ended up being court cases, and in some cases, those firings that occurred in March, the courts haven't quite worked through whether or not that was the right thing to do or a legal thing to do in March, and in some cases, the courts have worked through. They may have said temporarily, no, we don't think you can fire them. And they may have gotten permission, or the court may have ruled on a different issue that has allowed those workers to ultimately be fired. This particular graph gives you a good summary of how many people were working in those agencies as of last year in September, which was before this administration, took over, before the new president was seated. And then you can see how many people were employed at those same agencies, a year later in September. This reflects all of the layoffs that happened, or not layoffs, all of the firings that happened this March. And there are some agencies specifically looking at education where they've had their workforce reduced by almost half from from March to now. And then the third column is the additional staff that has been notified that they are fired as of October 10th. So we've kind of had many workers lost their jobs in March, and now these are additional workers that are losing their jobs, and in some cases, the same agencies. There is a lot of confusion right now about who has actually been fired. There have been agencies where notices went out and then people were told that they were fired by mistake, and those people have been unfired. It's not quite rehired, but unfired. There's also a lot of people who are furloughed and don't have access to their government email right now, so they may not know whether or not they are on the list of positions that have been removed. And the administration has not, like, they have filed in court a list of reduction in force, here's how many people and where in various federal agencies, which is what the media is using to report on a lot of this. But there's also a lot of national advocates, and this is a link to one, that are trying to figure out where and confirm where there are workers who have been fired. So if you go to this link, you get an overview, but you also there's a whole list of different media outlets that are also trying to track, exactly who are among the more than 4,200 people who have been notified in this round that they don't have jobs. It does appear that there are certain agencies that have disproportionately had more workers fired. And, if you've been following these webinars for some time, you may remember that we discussed in May the president's proposal for the budget, which again is kind of looked at as a document that tells Congress, here's my priorities, and here's the green lights where I want more, where I think I like more investment, and green lights in terms of these are places that I would like to cut. We talked a lot about the content of that budget because there were some fairly big cuts proposed to the Department of Education and also the Department of Housing and Urban Development. And it does appear that many of the workers who were fired, who have received fired notices October 10th, were from those two agencies. So there is kind of a through line of, the president had ideas about which places they want, which agencies they wanted to prioritize and which they did not want to prioritize. And it looks like the pattern that's being followed here is following through on some of those initial ideas. Specifically, the Department of Housing and Urban Development has fired a lot of workers who investigate claims of discrimination, of housing discrimination and abuse, people who inspect and support, housing to make sure it's safe, and a lot of the workers who distribute federal money for affordable housing. So this is a continuation of some earlier decision making by the administration. HUD has already kind of reorganized and really reduced the number of staff that have been working on fair housing work and upholding federal fair housing laws, and reducing the number of people who are working on housing discrimination. It looks like these positions that have been removed are adding on to the impact of reducing those services. The Department of Education was kind of the big story for people with disabilities this week. They cut almost 20% of their current workforce. That's 20% on top of the cuts that were already made in March. And almost all, as in like there may be 2 to 5 people left, almost all of the workers in the Office of Special Education and Rehabilitative Services appear to be fired. And they're important because they implement the special education and disability vocational rehabilitation programs. Additionally, it looks like there were many more workers in the Office of Civil Rights that were cut. You might remember that that Office of Civil Rights, which handles IDEA complaints, among other things, had some pretty significant reductions in workforce in March, which have impacted their ability to take cases that are coming up to them. So what does that mean? Well, IDEA, the statute, has not changed. However, the federal workers and oversight have been pretty important to make sure that states are actually following the federal law, and that the federal funding that is flowing to states to help implement that law gets there. So there's some important functions that federal staff did. Again, all of these folks, it looks like, are no longer at the Department of Education, or at least they're in the pile of people that have been notified they've been fired. There's no longer any data collection to measure whether states are complying with IDEA. The federal staff that is, taking parent complaints when parents say, "Hey, my local district and my state is not giving me what I need, and I've exhausted my complaint process within the state. I need extra help." Those people are not there anymore. And there's also a lot of workers that get the funding to states and help when things go wrong. It looks like that the funding for this calendar year has been distributed, but it also looks like the people who distributed those funds are no longer, are among the folks that were fired. So if states run into any questions or issues with their current money, it's hard to know who will help them. And it's hard to know, we don't have a 2026 budget yet, but if funding is provided for states, it's unclear how that will, come to them. It's also important to remember that the federal education law, IDEA, exists because states wouldn't educate students with disabilities. So while nothing in the statutes has changed for parents, right? IEPs and 504 plans are still mandated, and they are implemented at the local level. It is also true that even though we have a federal education law, not all schools follow the law correctly. And sometimes that's a lack of knowledge, which is why the federal government has helped provide technical assistance. And sometimes that is, a deliberate action. So the federal, not having these workers at the federal Department of Education really creates a number of concerns for disability advocates and parents of students with disabilities, because they have been the oversight and the enforcement of the law when states are not doing what they need to for students with disabilities. National and state disability groups put out a pretty forceful response to these particular firings, and you can look at a couple of different examples of letters. More than in under 2 days, more than 400 national groups signed on to a letter to say, hey, these are staff that should not be removed for these reasons. Among the 4,200 plus people who were fired are also some pretty important workers within the Department of Health and Human Services. We will not focus on the Centers for Disease Control and some of the other sections, but again, SAMHSA, which is the Substance Abuse and Mental Health Services Administration, was an agency that took a lot of cuts earlier this year in March, and it does look like there are additional cuts that are being made here, including all of the employees at the Protection and Advocacy for Individuals with Mental Illness. These are the people that are really focused on monitoring how folks are treated in various congregate settings, including institutions, and get money out to states who are doing that function. A lot of the disability rights organizations, have a section devoted to PAMI, and the federal money coming down to them is to support and, making sure that the law is being followed and that people are being treated appropriately. There's also been a lot of workers who are who have been fired, who get money to states for various kinds of community mental health grants. And so it's unclear, because SAMHSA puts out so much funding to states to help run community-based mental health, it's really unclear what it means, for running of those programs when the staff that does those functions is no longer there. And within a couple of days, there has been a lawsuit filed specifically saying, hey, we don't think that you had the authority to fire these workers, all of them, during a shutdown, and some reasons for that. So we are now in a situation where the employee unions have filed a lawsuit, and the federal judge has temporarily blocked the firing of those thousands of workers. Since we're still in a shutdown, those workers aren't working right now anyway. However, the crux of the case is that the government is arguing, well, because I have authority to fire whomever I would like. And it is unclear how this case will ultimately work out. As you might remember, in March, we had a number of lawsuits that were, again, challenging various groups of workers that were being fired at that point by DOJ, which was not part of the administration. It was kind of in addition to. And some of those cases resulted in people keeping their jobs, but others of those cases, ultimately, the decision making allowed the administration to make those firings. So it's unclear, at this point, whether the 4,200 people that were fired last Friday will ultimately get their jobs back, or it will be okay to make these kinds of decisions about the federal workforce and programs that they operate. So the choice to fire federal workers was made by the administration, not Congress. In past government shutdowns, every single time federal workers were temporarily laid off during the shutdown. A shutdown has not been used as a way or excuse or a mechanism to permanently fire federal workers before. And it really is not clear if that is legal to do that. So if there are agencies or functions where there have been a lot of federal workers fired that you think are important to people with disabilities, the White House is actually the administration is who made that decision. So it is appropriate to contact the president and say, hey, we think that what these decisions that have been made will have a pretty big impact, and here's why. Some people have reported that they have not been able to get through, or they have said, well, I filled out the form, but I also want to make sure that my federal lawmakers, my 2 U.S. senators and my U.S. representative know that I contacted the president and said these things. It is also fine to follow up with your members of Congress and say, hey, this is what I communicated to the president. This is an action they have taken. But Congress, it's about federal agencies and funding that you have and programs that Congress has, approved and put into law and funded through the budget process. Continuing coverage of the impact of the reconciliation bill, just so folks know, many states use a set of companies. Deloitte is one. They contract with some technology companies to help them develop systems to decide whether people are eligible for Medicaid or not. And in the past year, there's been some investigations, and there's a link to the investigation from last year too, that have said, hey, some of these systems aren't actually that accurate, or they have some significant failures or mistakes that have cost people their Medicaid coverage. Um, and that a lot of times those, mistakes cost states a lot of money, and they aren't necessarily fixed right away. So the Senate has launched an inquiry into 4 companies that are being paid a lot to build eligibility systems for Medicaid. And I think that one of the reasons why this inquiry is happening now is that states in the next year are going to have to figure out how to newly implement all of the prove you're working or exempt requirements that were passed as part of HR 1 in July. And they have a short amount of time to do that. No federal guidance as of yet about what they must do or can do. And there's a lot of gray areas and decisions that are going to govern, what states need to do to change their systems to make sure they can comply with the new requirements for HR 1. And I think there's a lot of worry that not only are the changes that are in the new law, which were designed to cost people their coverage, that's how they save money. Not only are the changes themselves going to cost people their coverage, but if systems aren't able to run accurately and correctly, very in a very tight time frame, that it will really up the amount of people who lose Medicaid coverage, not because they're not eligible, because there are bureaucratic mistakes or system mistakes that happen. And then finally, there's been more discussion of the Rural Health Fund that was created in HR 1 as being a big investment in rural health. And so the Kaiser Foundation did a kind of little fact sheet on that. And as a reminder, the claim that there's this new big rural health fund doesn't quite hold up when you put it in the context of the other items that the bill HR 1 also put in place. So the Rural Health Fund, it's a 5-year, $50 billion investment. Half of the money is equally allotted to every state, and the other half, the Federal Department of Health and Human Services has the discretion to award as it will. And that $50 billion is just a little over a third of the expected loss of federal funding that's going to happen because of the rest of HR 1. So the Medicaid cuts alone in HR 1 would be at least $137 billion in cost. Rural areas, $137 billion. $50 billion, which of course is divided out across all states and maybe disproportionately, is not going to make up for that loss. And that loss doesn't account for other changes that may cost people who are insured in the ACA marketplace their coverage, and more people not having any insurance who still are trying to figure out how to access healthcare. The other thing that this article points out is, the $50 billion fund isn't just operating money. That's not what it is at all. It's temporary. The $50 billion fund ends, but the reductions in federal spending in Medicaid and the ACA are long-term. So the money for the Rural Health Fund isn't providing continued funding. It isn't providing operational funding. It can be more narrowly used to for a limited set of items. And even if that money is successful in triggering innovative ways to deliver care for a lower cost, that it might not be enough or happen soon enough to really outrun the business decisions that rural healthcare has to make in the immediate future. A couple $1 billion to a state from this fund may not be sufficient enough to outweigh the real operational shortfalls that some of these clinics are facing right now and know that they will continue to face over the next few years. So I think this article is coming out because you hear more and more politicians talking about the importance of this fund and painting it as a way that this is going to be able to save rural health care. And the experts are saying that's simply not true. And the last thing in here, I've continued to include the slides about what are some important implementation points. Wisconsin continues to not have the money it needs to continue running SNAP the same way. The state legislature did not add additional money when it had a session day this week. So that continues to be an outstanding thing. Again, November 1st becomes a very important date because that is when we start counting all errors from October 31st all the way back to July 4th. And those errors can result in a financial penalty for SNAP. So there are going to be kind of more and more impacts that are coming from HR 1 as the year advances, in addition to the challenges that we're facing getting a federal permanent budget passed, as well as the money that's been allocated to, getting to the right place that it's supposed to go. Next week, we were having our self-determination conference. So we will not have a webinar next Friday. We will restart our webinars on October 31st, Halloween. So we hope to see you at the conference. We'll be doing a little celebration for all the work that all of you have been doing throughout this year. And then we will be back to our normal schedule starting the 31st.